Modern healthcare faces a demographic transformation. An aging global population carries a heavy burden of complex, non-communicable diseases, triggering failures across multiple biological networks. Standard models of advanced clinical training often address these complexities by narrowing a practitioner's focus into highly specific, isolated academic silos. This tradition segments expertise into discrete, often disconnected fields: orthopedics, neurology, cardiopulmonary, pediatrics, and geriatrics. This creates a physiological paradox. Attempting to treat an orthopedic limitation in isolation often fails because that single limitation directly restricts the mobility required to prevent cardiovascular decline in an elderly patient. Resolving these integrated health challenges requires a generation of researchers capable of analyzing human movement without the constraints of systemic boundaries. To meet the demands of these multi-systemic crises, physical therapy education must redesign the structural foundations of its highest level of research training. Within this evolving landscape, Chulalongkorn University developed the revised 2569 PhD curriculum in physical therapy as a structural intervention for these modern health paradigms. The program's philosophy shifts the objective away from advanced clinical practice toward the deliberate generation of new evidence-based knowledge and the cultivation of leading academic researchers. This distinguishes the doctoral path from master's-level education, where the focus remains on the expert application of existing evidence to specific patient populations. Implementing this change required a radical structural departure from the established educational architecture. The curriculum architects executed this shift by completely abolishing all clinical subdisciplines within the PhD framework. Removing these specializations acts as a forced pedagogical mechanism, ensuring that all doctoral research occurs at an integrated systems level. We can identify the extent of this change by comparing the doctoral structure to the university's Master of Science (MSc) model. The master's program architecture relies on maintaining specialized boundaries, formally categorizing students into 5 branches: cardiopulmonary, neurology, orthopedics, pediatrics, and geriatrics. The revised PhD document marks an explicit departure from this segmented approach. The documentation detailing the program's core significance provides the formal proof of this structural pivot. The curriculum specifically identifies the abolition of branch separation as the primary tool to promote cross-disciplinary integration. This change ensures that PhD candidates are no longer confined to a single bodily system when defining their research scope. By dismantling academic silos, the curriculum compels candidates to study the patient as a complete, complex ecosystem, mirroring the reality of multi-systemic pathologies. This philosophy is codified through Program Learning Outcomes, or PLOs, the specific blueprints that define the competencies of the ideal graduate. The curriculum mapping matrix details exactly how individual courses are assigned to fulfill these rigorous outcomes. The columns for PLO 1 and 2 highlight the program's most demanding requirements: the ability to synthesize existing data and generate entirely new theoretical models. This matrix integrates different fields by requiring courses from disparate traditional disciplines to overlap and support a single unified outcome. This creates an intellectual convergence, where courses like functional anatomy and advanced clinical neurology merge into a central objective: the design of original, multi-systemic research. Solving mobility issues in an aging population requires bridging the gap between neurology and functional anatomy simultaneously. The curriculum systematically engineers cross-disciplinary innovation by making these intersections mandatory through its course requirements. Modern systems-level research also demands a high degree of technological fluency to parse complex data. PLO 3 explicitly mandates the use of digital technology in physical therapy research, a requirement specifically tethered to Course 3742630. The syllabus for this course covers scientific communication, data visualization, and the applications of artificial intelligence. The curriculum identifies the application of AI tools as a core competency for the modern doctoral candidate. The curriculum positions AI as a required analytical tool for parsing massive datasets of human movement and identifying hidden systemic health variables. These AI algorithms process biomechanical data streams, allowing researchers to detect patterns in human health that traditional observation alone might miss. The modern doctoral researcher functions as a data scientist, applying sophisticated digital leverage to the study of the human body. The degree then moves from these structural components into a strict chronological execution across 4 years. This formal matrix outlines the escalating expectations for learning outcomes across every academic year. Year 1 focuses on the critical analysis of theory and the identification of complex cross-disciplinary clinical problems. In Year 2, the expectation shifts toward complex clinical reasoning and the formalization of an original conceptual framework. During Years 3 and 4, the candidate moves into the execution of independent research and the presentation of an international defense. This timeline methodically transitions the candidate from a consumer of existing research to a global producer of new models. These stages culminate in the program's highest objectives: academic leadership and communication. Outcomes 4 and 5 ensure that groundbreaking research is effectively communicated on an international scale and managed with professional ethics. Solving global health paradigms requires graduates with the authority and the skill to influence international healthcare protocols and policies. The graduate emerges as a specialist in clinical integration, digital technology, and global leadership. This final mandate focuses on global influence, ensuring that research findings penetrate international borders to change how the world approaches rehabilitation. The CHULALONGKORN PhD in physical therapy structurally engineers leaders equipped to rewrite the protocols of global health.